everyone, welcome to SCube TV. I am your host Rajni Bharara, and today on the show I have with me a very special guest. He is a cancer surgeon and his name is Dr. Syed Nusrath. And today on the show we are going to speak with him about cancer, and I'll be asking to him some basic questions regarding cancer. But before, let's welcome him to SCube TV and also to the show. Hello, doctor. Welcome to SCube TV and welcome to the show.
Hi. Welcome to SCube. Thank you very much.
Thank you. And you are most welcome here. And also, doctor, I would like to know from you, I have introduced you as a cancer surgeon, which you are, of course. But with that, I also would like to ask you if you can please introduce yourself and also can speak about your journey a bit to the audiences.
Hi, Anchor. Nice meeting you. This is Dr. Syed Nusrath. I'm professor and head of the department, Deccan College of Medical Sciences.
That's great.
And I'm a cancer surgeon where I've taken training from Long Beach Memorial Cancer Center, Los Angeles. And then I've been trained in Kidwai Memorial Institute of Oncology, which is in Bangalore. So I've taken training over there for cancer surgery. So we have a cancer hospital. So the passion for me is cancer and laparoscopic surgery, because this is the most thing which is evolving in this country, especially Telangana, most especially Hyderabad. So the background of mine is my father was a cancer specialist who has started the Mehdi Nawazing Institute of Cancer Hospital. So that's how I got passion. Then we have a family hospital of BB Cancer Hospital. And then I'm presently working in Deccan College of Medical Sciences as professor and head of the department of surgery.
Thank you so much, doctor, for the amazing introduction. And that's a beautiful journey and that's a great introduction. With this also, I would like to know from you, doctor, that I actually would now directly like to jump to the topic of discussion today, which is cancer. So I actually would like to know from you, if you can please talk about, so when we talk about cancer, so it is a very, very big disease which people are scared of. And so when I ask from you, so if you can please explain that who gets cancer, is there any criteria of people or are there any certain people who gets cancer, and if yes, who are they?
Yes, first of all, cancer is not a contagious disease. That is the most important thing you should know. Because people are afraid that it's a contagious disease. It's not like AIDS or any other disease. From person to person it gets. Now, the cancer has got from head to toe. You can have cancer over the brain, you can have cancer over the head, you can have cancer of the eye, nose, ear, throat, and then oral cavity, gums, tongue, then comes to the thyroid gland, then it comes to the lymph node, then we have the blood cancer, then in the females you have the breast cancer, then you have cancer of the stomach, cancer of the liver, cancer of the small intestine, cancer of the rectum, cancer of the bladder, and finally bone cancer, and finally skin cancer. So now cancer has taken place everywhere, lung cancer and blood cancer finally. Yeah. And in the female, most commonly we are having the breast and the cervical cancer. So these are the two most important cancer, which is causing a very big problem in this country. And over large, it's creating a big problem and a big menace. And remember, cancer is not a contagious disease. Some cancers are there, like breast cancer, it runs in family. It may be grandmother must be suffering, that the granddaughter may have, or the daughter may have. So it is totally not contagious. So one has not to be afraid of the disease. It runs in the family in some cases, but not in all cases.
Okay. So, doctor, also, okay, great. That's a great explanation. But also, I would like to know from you what actually causes cancer. I mean, you actually have explained that it is not contagious, but what causes cancer in people? And are there any symptoms? I mean, we'll talk about symptoms later, but what causes cancer?
Yes, that's a good question. Now, there are so many factors. We call it as a predisposing factor, which is the most common as for cancer. The first and foremost is coming to the oral cancer. What happens is a person takes BD, or he takes that tobacco, and he chews. So he has got a tongue cancer, or he takes spicy food, or he consumes spirit. So yeah, again you have a tongue cancer. Then you have oral cancer where they're taking this tobacco. That is the most important cancer. And in some places, they smoke the chutta with the other side in the mouth. So that is causing oral cancer. Then you have lip cancer. Then you have the tongue cancer. Then you have the throat cancer. So these are the various type of cancer which is causing due to the disease. Now, some people take alcohol. So you will have cancer from the esophagus to the stomach. So it keeps on progressing these cancers to different part of the place. Now there are some cancers which will be affected. Number one, due to exposure of the rays, sunlight. So you have got cancer over the eyes, over the face. You have skin cancer, we call it. So that is a different type. Now again, one more cancer which is known as the lung cancer, which is most and most common due to cigarette smokers. What happens is these people, they smoke cigarette, so they develop lung cancer. And what happens in the female passive smokers, like the wife or the young children who are staying, they are the passive smoker and they also develop cancer. So these are the most important cause for the cancers.
Okay. But doctor, also there are cases where, people smoke, people are chain smokers, but they don't develop cancer. So why does that happen? And also there are some people who do not drink, who do not smoke and does nothing, and they develop cancer too. So why does that happen?
That is the most common etiology which we doctors also we don't know, which we put them in the unknown etiology. There are some cancers where some people, they don't smoke at all and they develop cancer. Now we have two type of cancer. One is the small cell lung cancer. Another one is the non-small cell lung cancer. So there are some people, what you are saying is right. Some people, they don't have alcohol. So these are the hidden in the cancer where they don't do these things and still they develop the cancer, which is known as the predisposing factors is unknown and the etiology is also unknown in this case.
Okay. So you basically are saying that even doctors doesn't have an answer to this question.
Yeah, some cases that's
in
very
some cases.
Yeah, that's very minute percentage of patients where we have unknown etiology, and that is in all diseases. Like still now we for the COVID-19, the same thing, because this is the oldest disease, and still there is lots and lots of research which is going on in treating this cancer, and the government and the whole world is pumping so much money to identify exactly and to prevent it. Prevention is more important in this.
Yeah. Oh, okay, great. So, doctor, with this also, I have one more question. So, when a person is fit and fine and healthy and everything, so the normal life is going in a very, well manner and a great manner, but suddenly they, changes happen to their body, and then they visit a doctor, and then they are told that they must be developing a cancer inside their body. So, when we are looking at a person who might be developing cancer in their body, what are the symptoms that we should be looking for?
Yes, the most important thing in cancer, it is painless to start with. So that is the reason what happens is that the patients does not go to the doctor. That is the first and foremost. A painless lump, a sore, when there's an unusual bleeding, immediately you go to the doctor and get tested. Because what is happening is in the earlier stage itself, they are not identified. Once you identify, we call it T1, T2, T3, T4. These are the stages we keep increasing the patients. So once it is identified in the early stages, definitely there's a cure. People say cancer is cancer. No, you have early stages. Now the research is going on so much that first of all, what happens is they identify the patient, what is happening. So there is a lot of screening going on. For instance, they take that breast cancer. What happens in the breast cancer is we are doing self-breast examination. We are telling the patients to get it done. Then we are doing mammography. Mammography is a very, very important tool where they are doing ultrasound scan of the breast they are doing. So they identify whether this patient is suffering, and especially if the family history has got cancer, what happens is you do the screening. So once you do the screening, definitely colonic cancer, they're doing colonoscopy after 40 to 50 years of ages. Whenever the patient has got bleeding from the passing from the motion, you do a colonoscopy, 100% you can find out. The screening modality is very, very important because cancer in the initial stage, it is painless to start with.
Okay.
Wherever it starts, it is painless. As it progresses, the pain starts, and by the time they go to the doctor, it's incurable.
Okay. So also, doctor, there are too many stages of cancer. Can you explain them in brief, please?
Yes, that's a nice question. You seem to be a medical touch professional. So what happens is, number one, it is a stage 1 disease. That is, we grade the tumor, whether it is a T1 tumor, where we identify whether it's the initial stages. So in that case, if you find out and you do a biopsy or you do an investigation, cure is 90%. We, especially in Owaisi Hospital, Deccan College of Medical Sciences, we have operated lots and lots of cases where it comes in initial stage. Initial stage cure is good because 3 modality of treatment is there. Number 1, it is surgery. Number 2, it is radiation therapy. And number 3, it is chemotherapy. And now we have future also immunotherapy. So what happens is, in the initial...
Your head is, I'm so sorry to interrupt you, but your head is actually cutting. Can you please? Yeah, that's better. Yeah.
So once you identify the disease in the initial stage, that is T1 stage or even T2 stage, what happens is the cure is good, provided you get a complete treatment, because it's a very expensive treatment. Surgery cost, then comes the radiation therapy, then comes the chemotherapy. We have seen patients for 20 to 25 years now who have not died of cancer, but they have died due to other disease. So you, through the media, you should convince the people that cancer is a curable and a treatable disease if found in the early stages. You find a lump anywhere, you go to the doctor, you get it checked. We take a tissue biopsy, which is known as fine needle aspiration cytology, and we send it to the histopathological examination. And if it comes proof, only we'll do the surgery. There are some where it will be treated by radiotherapy. There are some which will be treated by surgery. Or there are some disease which will be treated by chemotherapy. So this modality is very, very important. So whenever a patient has got a lump anywhere, let it be anywhere, let it be in the forehead, let it be in the mouth, let it be in the oral cavity, it may not be 100% cancer. Just get a biopsy to say that this has got some malignant cells. Once we find out there are some malignant cells, then you will know exactly what it is and how you're going to treat it.
Okay. Great. So you are saying that every lump might not be cancer, but the cancer actually starts from a lump.
Exactly. As a small lump, it starts, or there will be bleeding, or there will be an ulcer which refuses to hold, or there will be an abnormal bleeding. Otherwise, if it is an oral cancer, there will be a change in voice. Patients will be able to. But all these are the predisposing factors which will happen. Like some people, they keep on giving singers or speech. So there is always an irritation, which is the most common cause. Multiple sexual partners will have cancer of the cervix. So these are the most important things. Then cancer of the penis we have, where they don't keep it clean. So that is the most important cause for carcinoma of the penis. They don't keep it clean. Smega gets collected. So these are the most important predisposing factor which one should be. Cleanliness you keep, cancer is not at all seen. You keep it neat and clean, the chances of cancer is very, very less.
Okay. Also, you mentioned that if one is having multiple partners, so they might, it might cause cancer to them. So would you say that using protection would be safe for them and might not cause cancer if they're having multiple partners?
See, it is not like multiple partners. A lady is having, what happens is when there is a friction, whenever there is a problem, then starts the cancer. So if you have safe sex, doesn't mean to say that you're not going to have cancer. Definitely you're going to have. But because you are irritating that area, That is the most important cause.
Okay. So you're saying that whether you have safe sex or not, but just because of the irritation in that sensitive area.
Yeah, that is the most important part. We have seen cancer in the vagina, we have seen the cervix, we have seen the uterus, we have seen the ovaries, we have seen the tubes also. So there are different factors which is causing, but cervical cancer is most commonly to multiple partners.
Okay. With this, doctor, also, you actually mentioned in the beginning that breast cancer happens due to, genetics. And if you have that in your genes, so you might also get, not you will, but you might also get breast cancer. So apart from breast cancer, do we have any other cancer that might be there because of your genes?
Genetic factor now they are identifying is most commonly the colonic cancer is also they are telling that it is most commonly due to genes. That is why what they are doing is that screening. They are screening the patients by doing colonoscopy and finding out whether this is hereditary. If the grandfather is having, the father is having. That's why the UK government is spending huge money to cure this colonic cancer. They are doing colonoscopy. They ask the patient to find out whether this patient is suffering from cancer or not.
Okay. With this, doctor, my other question to you is that can cancer be cured? I mean, do we have a cure for cancer?
Very nice question, I think. See, initial stage, first and foremost is go to the best doctor, go to the best specialist, discuss your problem, how long you're having from. If it is in the initial stage, 100% is curable. And if it is in the second or third stage also, you have the correct treatment. The modality is good nowadays, and the cure is very, very good in cancer, unlike previously, because we have latest equipment, we have latest surgery. The robotic surgery is come where we clear the whole thing now, totally, remove it, put the patient on radiotherapy, put the patient on chemotherapy, put the patient on immunotherapy, and then cure is definitely there. Because there is a lot of money and a lot of research which is going on in cancer. Which is very, very important nowadays. So the most important thing is prevention is better than cure.
Okay. Yeah. No. Okay. So, doctor, also my one more question to you. Whenever a patient gets cancer, so they are always suggested that, rather than India, you should go outside, you should go abroad for your treatment. So why is that still? I mean, why do we still have that scenario in our country? Do you think, as a cancer surgeon, do you think that India is still not that much developed to treat cancer patients and to cure them in comparison to foreign countries?
I'll tell you, madam, that's a very nice question, because what is happening is people are unnecessarily spending money going to Memorial Sloan Kettering Cancer Center that's in New York. I don't want to name, there are some film actors and politicians.
Yes.
We don't require. See, Tata Memorial Hospital is the best. We have hospitals in Hyderabad. We have hospital in Bombay. Everywhere, Delhi, we have hospital. And these people are the best surgeons, radiation therapists who get training from that country, bringing back and we have the best treatment in India now. We don't have anywhere. And through the media, you are supposed to say that it is the best treatment. Unnecessarily, they are going and spending money abroad. It does not happen. It does not happen. So what training they are giving, and now we have become a training hub and a medical hub. We have a treatment for cancer and disease space. The most important thing is we have more population and more deaths, and we see more cancer patients. So we are more experienced. If US population has 10 cancer patients, we have 100 cancer patients.
Yeah.
We have more doctors, more good services. The best of the treatment we have in India.
So I think, doctor, there could be only two reasons. Either they have a lot of money to spend, Or the second reason could be that they think Indians are less capable than the Western people or than the Western doctors.
And both things are wrong.
Yeah, both the things are wrong. Absolutely. Yeah, true. And also, before I let you go, one last question to you, doctor. So, now that you have mentioned all these politicians and celebrities, I would like to know from you that, nowadays, in the day, in the time of social media and everything, we are seeing a lot of celebrities getting cancer. So why is that? Why are all these celebrities getting cancer and are in comparison to other diseases, we are hearing that they are getting cancer. So why is that?
Number one, I'll tell you, at least let me be limited to breast cancer. What happens is the most important thing in breast cancer is the breastfeeding.
Okay.
Especially the celebrities, what they do is just to maintain, what they do is they don't use it. So the most important factor for the breast cancer is the breast milk. The moment the delivery is done, definitely you have to breastfeed the child. This is the most important cancer in women, especially breast cancer. The rest is due to irregular food habits. Then the most important thing is these people, they, for the keep themselves beautiful, they use all artificial things. These are the most important cancer. Smoking they do, alcohol they take, oral cancer they have. See, you should have control over your habits. You have a good control over your habits. You have good food, cancer will not touch you. Unless and until 1% chances of there, which still we are doing a research, blood cancer and all that, other cancer. Definitely research will be there in the tip of the iceberg everywhere.
So you're saying that because of their lifestyle and all the lifestyle that they have to maintain, because of that, they are getting
exactly
cancer.
That is the most important cause. And the last factor is 1%, which we also don't know the etiology, and there is a lot of still research going on in finding out what is the most common cause. And the genetic factors also play around. You just take the family history of an actress or an actor, or for instance, a politician. Probably in the old generation, the grandfather must be having, or the father must be having, just hidden, and they hide it. Once they come to the standard, they hide it. Probably, let me be frank with you, that is probably is a positive factor for them to cause cancer.
Okay. So one small thing, one small question. So, doctor, let's suppose there, in the family history, no one has ever gotten cancer. But then recently, a family member gets cancer out of nowhere, and then they develop that cancer has been found in the family member. So after that family member, when the future generation come, so will they also be having cancer?
It is better to get it screened, especially if it is a breast cancer, especially if it is cervical cancer. You get the generation for the next generation screened. And most commonly, this is important in breast cancer. Definitely somebody is going to suffer in that family.
Okay.
In the families, we are a cancer family, doctors, full of doctors. There are so many people. So we are getting our family screened so that what is the cause?
Okay.
So that is, so it is better always to get screening, early detection of cancer, which is preventable and which is curable. You go and get a mammography done, the smallest of the smallest swelling in the breast will be identified. Cure is good. 20 years disease-free survival. Same thing. Get a chest X-ray done. If at all you're a smoker or a passive smoker, you will find a small nodule in the lung. Again, oral cancer, again, a small thing. You take a biopsy and find out. Definitely the cure. Earlier, the better. Earlier the stage, the better the cure.
Okay. So once the cancer has been cured, can it also develop again?
Very, very rare. Very, very rare. Very, very rare. We call it as second malignancy. Sometimes what happened, like Angelina Jolie, what she has done, she got both the breast removed. That is called prevention. So it can happen with 1 in 1,000, 1 in 1 lakh people will have, but definitely, yes, it is known as the second malignancy. It may be in the breast, it may be in the colon, it may be in the uterus, it may be in the ovary.
Okay. All right. Thank you so much, Doctor, for coming to SCube TV and speaking with us. It was so lovely speaking with you, and such an educational episode it was, and you gave so much information. Thank you so much for coming to the show.
It was nice talking to you. Take care. Stay safe. Bye then.
You too. All right, guys, that's it from SCube TV. Keep on watching and do subscribe to the channel.